Assalamu alaikum everyone. Today we're gonna talk about narrus facialis and narrus intermedius. I hope and I believe that you will get beneficial information for future career. First of all, look at that. In this illustration, we provide information the normal anatomy of the facial nerve and narrus intermedius, and there is a connection between the hemispheres and the brainstem, and there is a schematic view of the fibers of the narrus facialis and intermedius. First of all, we should talk about the anatomy of the facial nerve. There are several branches of the facial nerve, and according to the function, the facial nerve is pure motor. It's only responsible for contracting the muscles, more specifically facial muscles, for expression your mood or anger and something like that. Okay, and in the blue color you can find out the fibers that's responsible for contracting the facial muscles. And according to the narrus intermedius, have two functions: sensory function and parasympathetic innervation function. Okay, and I will draw that two fibers. First one is greater petrosal nerve. Greater petrosal nerve, that's greater petrosal nerve, and ends in the pterygopalatine ganglion. In the pterygopalatine ganglion exist two fibers. First one is direct to the lacrimal glands. Second one is nasal glands. Both of them stimulate the discharging and stimulate the function of the glands. And the next fiber is hordotympany. Hordotympany contains two fibers. First one is sensory fibers. They receive the taste fibers from the anterior two-thirds of the tongue, and that's drawn in the blue, and I draw in the green line is parasympathetic innervation of the sublingual and submandibular nerves. They give their stimuli to the glands, and glands function will increase. Okay, and the next fibers is there is 5 fibers that are responsible for contracting the facial muscles. Okay, now the next information is about the connection between the hemispheres and the brainstem. You know, the facial nerve is a pure motor nerve, and it has two neurons: primary motor neurons located in the precentral gyrus and secondary motor neurons located in the brainstem. And the facial nucleus have two parts: facial nucleus upper part and the lower part. Okay, upper part is responsible for innervating this part of the face, and the lower part is responsible for innervating these parts of the face. Okay, now, and according to the connection between the primary motor neurons and secondary motor neurons, both of them have different structures. Okay, and the superior nucleus of facial nerve receive information from both hemispheres, from the right and the left, but the inferior nucleus receive only one side, only contralateral side. Okay, and for example, the nucleus that located in the left side receives only impulse from the right side. Okay, that's clear. And we should provide information about the facial nerve dysfunction according to the lesion located in the hemispheres and the brainstem, or in the periphery. Okay, and if the lesion located to the right side, we can see that there is no any abnormalities in the facial nerve that's responsible for innervating this part, because this nucleus receive impulses from this side also. But we should paralysis on this part of the face, because this part of the face innervated from only contralateral. Lesion is located there, and this part of the face couldn't act its normal function. Okay, and the next information is about the combination of the nervus intermedius and the facial nerve. As I mentioned above, the facial nerve is pure motor nerve, and its main function is innervating the facial muscles that's responsible for our emotion, for exposing or for showing our emotion. Okay. Now, according to the site of the lesion, we can make a correct diagnosis by having conversation with the patient. Look at that. If the location, if the hemisphere is healthy and the lesion is located there, and it is kind of situation, the whole part of the face, one side, whole part of the face that's innervated by the facial nerve couldn't contract normally, and the normal side of the face pulls this side of the face, and if the lesion located in the left side, on the right side, the left side could pull them to the left side. Okay, and in this kind of situation, the right side will be damaged. The right side facial nerve will be damaged, and we can make a correct diagnosis according to the 5 location of the facial nerve. First one is this part. From the brain cavity, from the skull, it enters the temporal bone. Okay, when they enter in the temporal bone, they are accompanied by the vestibulocochlear nerve. You ask the patient who are suffering from the unilateral facial nerve palsy. Okay, and have you got any problems with your keeping balance or listening something or hearing something? If the patient say no, and there is healthy part of the nerve. Okay, and if the patient say yes, we should search the abnormalities there. And the next part is the second part is responsible for innervating lacrimal glands and nasal glands by greater petrosal nerve. And you say the patient, have you got any problem with your some kind of eye lacrimation or nasal discharge? If the patient say yes, you should search the lesion there, but no, you should go down there. Okay, and because there's healthy. And the next stage is nervus stapedius. Nervus stapedius that's responsible for contracting the stapedius. We will provide information in our next lessons about the muscle stapedius and its function. Its main function is maintaining the tension of the eardrum according to the stimulus that's given by outside. Okay. The patient, you ask the patient, have you got hyperacusis? If the patient couldn't understand, you should describe the situation. Have you got any problems with listening normal voices as a higher voices? And that's hyperacusis. And the patient say yes, you should search the lesion there. If the patient say no, you should search the lesion there. And the next stage is chordotympany. You should ask patient, have you got any problem with your taste when you eat something, and or some kind of dysfunction of your sublingual and submandibular glands? If the patient say yes, you should search the lesion there, and no, you should go down there. And our next stage is I should provide information about stylomastoid foramen. Stylomastoid foramen is located there. And all of this above mentioned function is normal. You should search the lesion there. Okay, and it may be pure motor lesions that relate to nervus intermedius and facialis. And another one further question for you is the somatic innervation of the skin. Although the nervus intermedius participate in this only small part of the skin that's located the external auditory canal. Okay, in external auditory canal is supplied by variety of cranial nerves, and in our next lesson I will provide information about that. And one clinical consideration is that's the pseudounipolar cells and that's the geniculate ganglion. And you know, the ganglion is so cool part for herpes zoster. And when the herpes zoster become active, and it can show its negative effect, like herpes zoster that located in our thorax or the nervus trigeminus. And in this kind of situation, the only dermatome that's innervated by the posterior auricular nerve is contains some kind of vesicles, and some kind of pain can be felt there. And according to this, you can analyze the facial nerve herpes zoster activation. Okay, and one further information for you is that some kind of damage that occurred with this part can cause some kind of exciting condition in the patient. You know, after damage, the Schwann cells regenerate the myelin part of the axons, and during this regeneration, there's some kind of connection might happen between the greater petrosal nerve and harder tympani. Okay, and the harder tympani, and which kind of action might happen there. And when you eat something, your lacrimal glands and nasal glands will be overactivated, and there is one reason is that harder tympani is responsible for innervating submandibular and sublingual nerve glands to discharge saliva, and during that time this impulse is carried there, and because of connection between the greater petrosal nerve and harder tympani, there might be exciting question that you're eating something can cause some kind of eye drop from your eye because of overstimulation of the greater petrosal nerve simultaneously. Okay, all of the information is all for you today. Thanks for listening and watching, and if you have any suggestion or some kind of complaints or offers, we're always ready to receive from you in the comment part of our YouTube channel. Thanks for listening and watching one more time. Take care of yourself. See you next time.